This is Frank Islam, Chairman and CEO of FY Investment Group, and your host of Washington Calling, where we interview leading voices from business, politics that impact you, the viewer. Today, our guest is Dr. Ravi Godse. He's an attending physician at Shadyside Hospital, located in Pittsburgh, Pennsylvania. As you probably, he needs to balance what he does in terms of the practice and also produce and directed many feature films. And I want him to let us know what kind of feature films he produces and what's the theme of the story he has. Ravi, welcome to our show. Thank you for coming.
Thank you. Thanks for having me.
You're most welcome. So, Ravi, you have a remarkable success story. So, tell us a little bit about when did you come to the United States from India, and what made you to cross the Atlantic Ocean to realize the American dream? And do you think that America has given you the letters of opportunity to succeed?
Absolutely. I came to United States in 1995 and I loved India and I speak several Indian languages, but I always loved to travel. And my Pennsylvania driver's license lets me drive anywhere in the world. Because I've done some crazy drives. I once flew into Stockholm alone and flew towards North Pole till I got bored. Then I turned back, told my Indian friends that I couldn't find parking on the North Pole, and they all believed me. I've driven alone into Sahara. Yeah. I
Oh,
have
my Sahara
driven
Desert,
from Atlantic to Pacific. So I love traveling. And the fact is if you have a US passport and if you're traveling from US with dollars, it's so much easier, to travel. That was my main motivation, one of the main motivations to come to United States. And United States did help me fulfill every dream. Winston Churchill used to say about democracy that it is the worst form of the government except for all the other forms. So we hear about a lot of things going on here and there, but I think still this is the best place on the face of the earth. And Pittsburgh is one of the most beautiful places. You know that you were there, right?
yes. So I can relate to you because of the fact that I've been here, let's see, about 50 years. I came here when I was 14 years old. So I realized the American dream is America's inclusiveness and openness that provided me the letters of opportunity to succeed. These are the values of America that we can all proudly and truly embrace. And that's the reason I'm politically engaged in it. So tell us, as I understand you're a doctor, you're a practicing doctor. Are you professionally
Yes.
satisfied with your years of practice in the United States? What challenges did you face in your practice, and how will you be able to overcome those challenges? And what lessons have you learned from those challenges?
Well, the
Mouthful.
thing is, Western Pennsylvania has been so friendly. When I
Yes.
first landed in United States, I landed in Pittsburgh Airport. I was coming from Bombay in 1995, and in Bombay, the luggage carts were free. We used to call them trolleys. So I assume I'm coming to advanced countries, so the luggage carts would be free, and the cart won't loosen. They were asking for three quarters. I didn't even know what a quarter was. And a lady came out of nowhere. She put three quarters, helped me load the luggage, and said, "Welcome to United States." I mean, that's exactly the story of the nation. And I've
Very nice.
had no trouble. Only time I faced discrimination was I thought people were extra nice to me. They were trying to cut me some slack. And obviously I speak English very well. Means I was not too long ago when I was a child, I was barely cognizant with it, and then I transitioned from tolerably proficient to maybe terribly prolific even. But I, of course, have a delicate accent, and people went out of their way to help me. There were no real challenges to say. Everybody was friendly, inclusive, and you're going to occasionally somebody says something, and that's fine. But most, more like 99.99%. And only reason to mention these one or two minor incidents might be because that was such an anomaly. It was so outside the norm. Regarding comparing practicing between India and United States, and I think India is like retention based, knowledge based system, which was fine then. So say for example, I love history, and if somebody asks me what year was the Battle of Waterloo, I might be the only person to know it's 1815, but now people just quickly Google it. And so, are we judging people by the speed of their internet connection? So now we have to think about applying what you know. So in United States, right from day one, what I was impressed about, like not what you know, but what you're doing with it, how you're applying with it, you know. So when we are running elections for the student body, somebody said that guy needs to be the like financier. I said, why? They said he knows 51 causes of pericardial effusion. I said, what does it matter if the patient has pericardial effusion due to one thing? Just know it, diagnose it, move on. Why should he be a financer for that? You know, right? So I think that's vastly different. And United States has been very smart about like how to apply things like applied physics, you know, all the things that are very practical, very smart, you know, like finding out a neuro Lewis and Clark's expedition, you know, the Louisiana Purchase. So I really like the ingenuity and like how differently they look at things. Like to quickly to not to give too long an answer, but in 1956 there was a struggling salesman and he couldn't sell any Ford cars, and he came up with an idea: 56 for 56. You pay $56 per month and you drive a 56 Ford home, Lee Iacocca. I mean,
Wow.
that's United States, and I love about that. Yeah.
As you know, Ravi, we are living in unprecedented upheaval that we hold dear to our daily lives. That's the coronavirus pandemic. It has overwhelmed the global health systems. Do you believe that we'll be able to overcome this challenge?
Absolutely. We have seen many other challenges like that, and when we look back, we always think that there will be a new normal. And I don't even know what people are talking about new normal. Long as it is more normal than new, I think people would be fine. But the thing is, and now I have to be very careful because I am a practicing healthcare provider, so I have to say it very carefully. It's a professional opinion. But corona is a RNA virus, and the RNA virus can mutate. Now, they can mutate for worse and they can mutate for the better. My gut feeling, I can't say it scientifically, my personal gut feeling is that this virus might have already mutated for the better and it might have become less infectious. The summer is coming, humidity is coming. Every 1 centigrade increase in the temperature will reduce the infectiousness by couple 2% points at least, you know. Humidity makes the droplets fall to the ground quicker. I think the world will be surprised that we are going to overcome this very soon. And when we look back, you know, well, like we will be telling stories like 5, 10 years later, like, you know, as to how we survived during that period. But I think we are almost again, quoting Churchill, like this is not, we are definitely at the beginning, end of the beginning, you know, right?
End of the beginning. Do you think it's going to come back in the fall?
I think even if it comes back, it is not going to matter if it is mutated to a lower version. And you know, now the doctors have become much smarter. We know how to treat it. We know, actually, you know, we may not know too much still. So we know what we don't know. We don't know what we don't know.
We do not
But
know.
we are doing some things like not everybody needs to go on ventilator. They are
Okay.
tolerating oxygen very well. The mortality rate is much lower than Italy, though it is a little worse than India. So I definitely think vaccine might be coming. Medication like remdesivir are working to cut down the infectious rate from 15 days to 11 days. Plasma might be in use. I think we are going to be okay. Right?
Let me talking about the drug. I may not be able to pronounce the correct pronunciations. It's called. There's a lot of discussion on the hydroxychloroquine. Did I get it right?
Yes, yes, yes.
Okay.
In
And
United
as you
States, is
talk,
also called as Plaquenil. Yeah.
that is correct. The WHO, which is the part of the United Nations Organization (EU), has suspended the trials while the Indian Council of Medical Research has given its qualified approval. Do you believe that this drug has a side effect, has a long-term effect, and do you think the study claims that I heard that it increases the risk of the death? Can you shed some bright light on this?
Absolutely. Again, I'm saying more as like a friendly opinion, you know, not a professional opinion, but it's very simple. First things first, okay? The most important creed of our noble brethren is do no harm. So we have to make sure we are not harming somebody, okay? Now, before we go to the studies that may or may not have showed whether hydroxychloroquine did some side effects, the medication is called Plaquenil, and it is
Hmm.
used for lupus arthritis, and those patients take that dose daily for years. So I talked to a friend of mine in United Kingdom, advanced nation. He has about 5,700 patients in his practice on Plaquenil for past 15 to 18 years, and he has done zero EKGs so far. Zero, zip, gels, nada, no EKGs. Okay. So on a daily chronic low dose use, they don't look at really even monitor for cardiac side effects. If the effect comes in the QT interval when the medication is taken in combination with other drugs like azithromycin or zithromax, or they are
Hmm.
taken in the higher doses. Now, EU suspended the study, World Health Organization suspended the study, but that was based on the Lancet study. And Lancet study was based on the data, and now that data is being pulled. So those EU and other countries might go back and restart this trial. And let's look at it from a different way. Let's look at it from an Indian perspective. Okay. At the end of the day, the proof is in the pudding, like we say. India has a population of 1.353 billion, ultimate poverty, no social distancing. There are some cities and villages in India that have never seen a ventilator, much less heard about it. If you go into
Right.
Google Translator and put ventilator in English to Hindi translation, there is no word for ventilator in Hindi language. They call it pankha, like a fan, a ceiling fan. So still, India's deaths are like 5,000, 6,000, and maybe India's peak had not come yet. India has not tested enough. But
Right.
India is using hydroxychloroquine like candy. They are giving it to like any hospital that I talk to. I have like hundreds of friends in India, and they are all using hydroxychloroquine. Unfortunately, they are not publishing it. They keep waiting for studies. They say they were my friends in doctor friends in India were breathlessly waiting for a French study on hydroxychloroquine. That study had 181 people. I said, dude, like when I took a train in Bombay, there were more people on my train than the entire Napoleon's army of Italy. Why are you waiting for the rest of the world to give you the studies? So India should start publishing their own studies, and it might show that if taken early, this might prevent the illness. That is my gut feeling. Again, I cannot give it as a medical opinion, but I think the we will know in couple months. Okay.
Okay. I want to kind of, and that's what I don't want to get involved with the politics, but that's what the Trump, without understanding and not being a doctor, he should not prescribe people to take that. That's a totally wrong thing to do. But you know, uh, so
But
you think,
I wrote an article about it, and I said that just because our president says that it is good, that doesn't make it good. But that won't necessarily make it bad. So means don't people shouldn't jump on like if that medication saves life, if it does. Now there was a randomized control study in New England Journal, which is very highly respected, and that did not show any benefit for prophylaxis. So we think
right,
it should not be recommended as prophylaxis. But
right,
in India, any doctor friend that I talk to, who say, "Oh yeah, yeah, man, this is like really bad medicine," but I'm taking it. All of them are taking it for two months for prophylaxis. But that's like I don't know what to say. So I said, you're not offering it to your patients. They say, well, we are accepting to choose to take the risk ourselves. And that many doctors have not fallen prey to India. Who knows? We will know soon. But right now, that many people are not dying. Our mortality rate is going down.
right, right.
Remdesivir seems to be cutting it down. So I think there is hope.
You
We're
look,
gonna be okay. Right?
so I think you're looking at the brighter horizon when we endure storm, right?
Right. Absolutely. Absolutely. Yeah.
I want to
The
I
and
want to talk a little bit about the South Asian doctors. It's close to about 17% in the United States. How successful have Indian and South Asian doctors have been in America, and what makes them successful, and what has been the obstacle of this success? As you know, the South Asian doctors are vital to the U.S. healthcare system as well, and they have a lot of impact and influence in the medicine. So give us a little bit understanding in terms of the what makes them so successful.
I think South Asian doctors in general, means all doctors are hardworking, but I don't know whether we are a little friendlier. I give my cell phone number to the patient. I keep chatting. If I'm driving on Sunday, I might suddenly call somebody without any work and say, "Hey, how are you doing? What's going on?" They love us back, and so I think friendlier. They like it. I think South Asian doctors have been treated very well. Most of them have succeeded in American Dream. They are very successful. If at all there is any hindrance. I mean, I made a second my sec I know we are going to talk about the movies later, but in one of my movies it was a funny movie about an Asian doctor, what he feels. The movie was called I Am Schizophrenic and So Am I. And the doctor was slightly bitter for a while, and he said, like, I'm loved and everybody respects me, but the first mistake I make, somebody says, oh, maybe he doesn't understand how America works or something like that. I think the only impediment that the South Asian doctors have for themselves, like their organizations, is South Asian doctors themselves. I would say it in all humility and honesty. I think they think really small time. I mean, look at somebody like you. Means obviously doctors are not as successful as you are as an entrepreneur, but you
Thank
are
you.
successful. You are mainstream. You are affecting the US national politics. And when you are affecting US national politics, that means you are affecting the global politics. Our World
Hmm.
Series, our baseball
Well,
thing
thank
is
you.
called the World Series, right?
You're
So,
making a
you are
profound
focusing, yeah, so you are playing at a much bigger field. And the Indian doctors are like still stuck at that like small committees and the typical Indian thing. He said what, like small committees, they fight a little bit amongst each other. There is no cohesion. There is no broader scope of vision, right? So this is, I
That's a
think, the
good way to
thinking
put
is
it.
small time, right? Yeah. I mean,
I think you said it
Napoleon,
very
he
well.
was not. Sorry.
But I hope I would think as we move forward, they will organize and they will engage and they will vote and they will be part and parcel of America's fabric and society as we see it.
I mean, they
But
already are, but I think they'll be a little more influential, right? Yeah.
I think so. I think so. I think so. I want to talk about the filmmakers. My question is, how do you find time to do this filmmaking, and how do you balance it? And tell us a little bit about the movies that you make. And it's a wonderful thing to do for what you're doing.
Oh,
I'm
absolutely. I think finding the timing and balancing it is like we have a concept of quality in medicine, and that concept is doing the right thing the first time around and doing it correctly. So you do one thing nice and you take care of it. So say like I'm discharging a patient in the morning. So do
okay.
everything at that time. Do the medications, call the family. So there are no follow-ups, no phone calls. You finish it. You do it well. It's done. So when I'm talking about filmmaking, I actually apply principles of medicine to filmmaking. And one of the most important principle is when I'm with the patient, they have me 100%. Like my own entire focus is on them. And because what I practice in daily life is so important, it's literally life and death, that makes me look at filmmaking. It's not a hobby because I make the movies professionally, but it makes me think that it is not as important as what I do in my other walk of life. And that takes the stress away because I know at the end of the day, it's a movie. It's not a patient's life. So that gives me some kind of elan, some calm, when I'm approaching movie making. And regarding finding the time, I believe that the time management is like how you do certain things, and the parameters can change. So, say for example, take an extremely successful entrepreneur like you, and as a filmmaker, say I want to make a film on your life. I'll sensationalize it a little bit. Okay, all right. If it's a documentary, it will be true to type. But if we are making a movie, we'll make it like a little sensational. Okay. So suppose I'm making a movie on your life, and a prominent politician says that uh, they are available to give us like 2 minutes amongst your many friends. They are available to give us 2 minutes on Capital. So in filmmaking, what we do is, so we go to Capital, we shoot that scene, okay, and we have another scene somewhere else. Now, in what we do is we try to do everything at one time. So if we go to Capitol or if we go to Washington D.C., we finish all our scenes in Washington D.C. But if that person is available only for 10 minutes, then we make that the most important thing of the day and make everything
Okay.
else subordinate to it. So then move the
Very well.
camera, move the crew, move the cranes, whatever. So find out what is the one most important thing for the day, follow it logically, do it calmly, know that it is not as important as medicine, and there you go. You have a movie. I shoot like really quick. I shoot my movies like we have everything ready. So we were shooting a movie in India. That movie is called Remember Amnesia. That's my current
Okay.
movie, and it's
Okay.
coming out very soon on a platform. And it's an interesting concept. A physician loses his memory and can't remember whether he has killed his wife. Sounds kind of serious, but it's funny, right?
So,
So
so,
we were
so, so,
shooting. Sorry, go
so
ahead.
you making any money on these things, or this is just a hobby?
Yeah, I mean, the thing is, again, if you look at it from a pure business point of view, and you want to say you are talking about recouping the money,
Right.
if you spend less to begin with, then what you have to recoup is also much less. Our first movie was made in 5 days. And I'm not saying that, it was a mom pop movie. It was reviewed in, I think, New York Times. It went worldwide. It made a killing in DVD
Wow.
sales. It was a regular feature film. We made it in 5 days, and those days they used to sell DVDs. My current movie, you look at it, it's shot in 4K. Miss in India, when it got released theatrically, we could find only 3 theaters in entire India that were able to play the level of the technology, the background music, the drones. I mean, you would see that it's a regular feature Hollywood movie. And I made that movie in 8 days in probably what they use for a hairdresser's makeup in Hollywood. So my idea is I use two camera setups. I shoot really fast. I know what I want. I get it and I move on. So I think that's the key. And these days, unfortunately, because of the pandemic, people are hungry for content on platform. They are like
Right.
tired of seeing the same old thing again and again. So in a way, for filmmakers, if you have a content, I don't think it's that difficult. Right.
Oh, well, that's a wonderful. Before we close our conversation, I want to ask you: do you have any advice for the people, especially South Asian youth, who wants to follow in your footsteps, being a doctor, being a filmmaker, giving back to the country, sharing, and to whom much is given, much is expected, just like President Kennedy once said.
uh, I read an article in Hindustan Times by a very smart person. I think it was you. And that article talked about the H-1B visas. I just read it recently.
The one was published yesterday. Very, Ravi,
Right,
you're
right.
pretty good in this. Thank you very much.
Right. So I read that article about H-1B visas, and my advice to my South Asian friends would be: United States does not owe any country these jobs. H-1Bs are defined as the jobs that are not wanted by the Americans or the green card holders. Now, compared to 15, 20 years ago, so many Indian and Chinese parents who are focused on higher education and college are there. All their kids have become 17, 18 years old now. They all are getting a college degree. So, America may not need as many white collar people jobs to be shipped outside. In 1991, after the fall of Soviet Union, all those Soviet satellite countries, Kazakhstan, Turkmenistan, all those countries have given up Russian. They are all learning English. Chinese people are learning English. Chinese youth are learning English. French youth, the German youth. So the whole world. So now the South Asia has a big competition for the H1 jobs. My
Good
advice to
point.
South Asian youth would be, rather than trying to do a job that no other American wants to do, start and set up your own business, do some entrepreneurship, and then we are free to travel. Come to Disney, come visit us. But there may or may not be that many H1 jobs in the future, right? Like a
Oh,
smart
that's a
guy
very
said
well
yesterday.
said. Very well said. Well, thank you very much, Ravi, for your thoughts and for your leadership, for what all you do to make a profound difference in people's lives. And you are the best. Thank you very much. And your advice is very uh, profound and relevant to South Asians. So um, I hope they um, I hope they listen to you.
Thank you.
As
Thanks a lot. Okay. Namaste.
as the President Obama once said, that everything is possible when we learn from one another, when we listen to each other, when we set aside our differences to work for shared goals, shared responsibility, and shared sacrifice. And thank you for coming.
Absolutely.
This is Frank Islam wishing you a great week. Thank you for watching.